We'll wait for 3 more minutes and 8:05 we will start if it's okay.
Hi, Dr. Manoj.
Hi. We are starting. We are going live.
Yes, sir.
You want to start, Amit?
Yes, sir.
Start. Please start.
सर ऑडिबल नहीं है.
I'm not audible. Let me.
We're able to hear, ma'am.
We are able to.
Yes, sir. Okay. So, welcome everybody. And today we are on the second lecture of the medicine session for the lifestyle medicine wing of NNF. And it's really a great privilege to have a wonderful speaker in Professor Rajendran, who is head department of preventive cardiology at Coimbatore Medical College in Tamil Nadu. And sir is a excellent renowned figure, and he's talking about something which which is for doctors themselves, management of heart diseases through lifestyle. And this is part of Healthy Longevity Initiative, HLI, which has been started under the initiative of our President NNF, Dr. VC Manoj sir. And we are all looking forward to this, learning from the lecture. Myself being a cardiac patient, I'm really very excited to listen and to the points which he says, both preventive and treatment, I suppose. And with that, I go on to Dr. VC Manoj sir to please take forward the proceedings.
Thanks, Amit. Hello, everyone. Hearty welcome once again to this month's lecture in NNF Lifestyle Medicine Wing's monthly lecture series dedicated to familiarizing ourselves with the principles and practice of lifestyle medicine to age with grace. Given that the healthy lifespan of doctors is much below the national average in a country, as we were mentioning in our previous webinar also, it is imperative for us to learn how to care for ourselves rationally using the scientifically proven methods of lifestyle medicine. At the same time, it will come handy for us, whichever field of medicine we are practicing, to actually walk the talk when we advise our patients or parents or for patients. And the most important part, we need to be there for our families. And this is where the responsibility comes to even a greater extent. So today we have a very special guest speaker, Professor Dr. Rajendran, a plant-based cardiologist from Coimbatore, a person whom I hold in very high esteem, a true down-to-earth person. I would just describe him as a humble and great human being who is going to tell us about the relevance of lifestyle medicine in managing the biggest killer of our times. One of the biggest killer of our times, maybe the largest, depending on which area you're talking about, heart disease. So without wasting any more time, to moderate today's session, let me invite two good friends of mine, Dr. Srisailam from Nizamabad, Telangana, and Dr. Shwetal Bhatt from Ahmedabad, Gujarat. So over to you, Dr. Srisailam and Dr. Shwetal. Kindly take over and let's start with the lecture. Over to
Uh,
you.
Thank you so much, sir. Myself, I'm Dr. Shwetal Bhatt. I'm from Baroda, Gujarat, at Baroda Medical College, Government Medical College. And I and Dr. Srisailam are co-moderating the session. This is one of the very close to me, the webinar series, where we are going to discuss of the healthy lifestyle. And believe me, when I just a very short CV Dr. Manoj sir shared today morning, and I was was in awe that to work with a team is one of the for a allopathic doctor with a great team he has. That was like something fascinating to me that how he has adapted to and made a team. We have with us Dr. G. Rajendran sir. He's a professor and head of preventive cardiology from Coimbatore, PSDMSR College. And he has a full-fledged team with psychiatrist, community medicine professor, dietitian, psychologist, yoga, and naturopathy. Recently, we in the Pondicherry, we heard that there is a medical MBBS course where there is two pathies are going to, uh, there is one of the pilot project going on where the Ayurvedic and the MBBS is going to have, the students are going to learn two pathies together. So we definitely need such course or such curriculum where we can take the healthy part or the good part of each pathy and go ahead with the preventive aspects of disease. Sir is expert in providing whole food plant-based diet for cardiac patients since 2019. And his primary focus is on subclinical atherosclerosis, community cardiovascular health program, and behavioral cardiology. Sir, I welcome you, and I would like to share small incidents when I was studying in 12th standard, and my mother at a very young age she started developing angina, and I was thinking, how, why such things have happened? And we being from a very I'm being from a teacher background. My parents are my father is a professor and mother is a teacher, so not such a healthy junk food lifestyle, nothing. And still there was a angina developed at very young age, and I was wondering why. And I think today I'll get the answer for that, and will be really helpful for other family members. So thank you so much, sir, for accepting this invitation for our NNF colleagues. And over to you, sir, for your expert talk.
Welcome. On behalf of NNF India, I welcome you all. I'm Dr. Sri Shailam. Sir, heart disease today, I think we should all remember that it doesn't start just in the heart. It is the lifestyle that causes. So, friends, the topic is very, very relevant for all of us as we are all healthcare providers and we often preach lifestyle change to our patients. But, like for example, eat healthy, exercise, manage stress. But we rarely apply those same principles in our lives. So, the long hours, the irregular meals, stress, and the lack of rest are silently taking a toll on doctors' health. So, this session isn't just about patient care, but it is about self care. Over to you, Rajendran sir. We're eagerly waiting for you. Yeah, over to you, sir.
Dr. Rajendran?
Yeah, I'm sorry.
Yeah.
Good evening, everyone. And congratulations to the entire team for initiating a program like this to take care of our own selves. As many of you said that we don't take care of ourselves and the comorbidities are very high in doctors when compared to the patients whom they treat, unfortunately, in India. Am I audible?
Yes, sir.
Okay, fine.
Yes, yes, yes.
I have a problem in running the slides. We saw that earlier, it was working. Just
Go back
a
to
minute. I'll do it again.
Try again, otherwise we'll share from here.
Just a minute, just a minute. Visible now?
It's coming on. Yes.
Well, so first thing, let me start with some disclaimer. I'm not a board certified lifestyle medicine physician, unlike Dr. Manoj and his colleagues. So basically, whatever I am doing is basically from what I learned from books and, of course, some of my colleagues. So this presentation is assisted by AI, but the important thing is it's based on scientific literature. I have given the information and just created some of the pictures, and that's it. So let me start off with this to all of you. Akia, it's a way to wish. This is a Sardinian language. This is in Sardinian language. It's basically an acronym for A Kent Annos, which means health and live up to 100. So it's just not living up to 100, it is health as well as living up to 100. So healthy living is the best revenge. And when we had this COVID, we were crying saying that COVID is killing too many people. But let's see what the statistics say even during the COVID. So even during the COVID, COVID was the fourth killer, fourth in the list in terms of death rate. Even at that time, it was the heart disease which was heading the list. And that is the reason why people have called for a population level code blue. So that's the reason why we have a community medicine doctor also in our team. So when it comes to cardiology, we are all familiar with these three things: the pills, especially the statins, aspirin, and any other antiplatelet, and the bypass surgery and stents. Yes, it's true that science has revolutionized the management of heart disease, but has it actually taken away the heart disease incidence or the death? No. So the risk reduction by any of these interventions is not more than 30 to 40%. So this slide basically shows various studies wherein there is a residual risk of something between 58 to 79. So we all claim that science has improved, but see that what is the residual risk for coronary events. So even after treating with either bypass surgery or with the medications or with stenting, the risk which is remaining is so high. And we still are proud with whatever we are doing. So we are doing actually very little to the patient, and it's time we move on from there. So this is another illustration from the same article. This was published in somewhere 10 years ago. The red lines are the ones wherein the mortality is brought down by our intervention. And the orange lines are actually control of risk factors and the lifestyle modification. And there are still a small percentage where we do not know why the patient lives. This is despite us. That's what we often say like this. So we have always been used to talking about atherosclerotic heart disease in terms of ischemia. We always tell that this patient had an ischemic heart disease. So ischemia basically manifests once the blockages are significant. You can see on to your right, all these blockages are significant. The stenosis is significant. That is when we call them as ischemic heart disease, because it manifests as ischemia when the patient exerts or at rest. But it is time we move on to atheroma, basically even before it manifests in the subclinical stage. So this Lancet article, which was published in 2025, says that if we actually take care of the behavioral and metabolic risk factors, we can save around 82%, that is around 8.7 million lives per year globally. So that is where the lifestyle medicine plays a big role. All of us, including me, are all focusing on this tip of the iceberg, namely the cardiovascular disease. But there is a lot more beneath that. Of course, majority of us focus on this one also, namely the physiological changes, that's the blood pressure, sugar, obesity, and dyslipidemia. We stop, majority of the times, this is where we stop. But there is something in between, that is the subclinical atherosclerosis. So before the patient actually progresses into a full-fledged atherosclerosis causing ischemia, it is important it's picked up by a CT coronary calcium or carotid intimal medial thickness or ankle brachial index. So these, along with this, we also include pulse wave velocity in our Pearl clinic. So, but what is the cause for all these problems? It is our behavioral changes. That is the eating, exercise, stress, sleep, risky substances, and relationships. So these all six are put together as lifestyle medicine pillars. So I have slightly modified from what is given in the textbook. This is basically to make people retain all the six pillars very easily. So there are two E's and two S and two R's, basically two ESRs. Okay, is there evidence for this? Okay, so there are six pillars here, and various disease disorders have been quoted here. This is diabetes. So this is American Diabetic Association, American Heart Association, or an American College of Cardiology. This is for the stroke, and this is for the vascular cognitive impairment. So when we have enough of evidence to show that nutrition and physical activity definitely play a very positive role. Whereas for the rest of the things, of course, for smoking also, for the rest of the three pillars, you got huge evidence coming up for that. Okay. Now let's say this. This is again a study I've tried to take up the studies which have been published in 2025. So this was a study done in around 88,000 adults in Brazil, where they have taken the six pillars alone and they have correlated with the major CVDs or cardiometabolic disorders. So if somebody has a very high score in the six pillars, that is on the positive side, they have a very low prevalence of major cardiovascular disease. Let me skip this slide. And this is the Interheart study, which is often quoted in any of the major talks. This is a study which was conducted in 52 countries. It's a large standardized case control study. One of the countries was definitely India. And what is important is they say if somebody is quit smoking and he takes care of his lipids, in 2/3 of the individual, the heart disease incidence comes down. And if you're going to take lots of fruits and vegetables, 1/3 of the incidence comes down, and 80% mortality comes down if people start exercising along with eating lots of fruits and vegetables and quitting smoking. Okay, there is an interesting point. when we keep on saying alcohol consumption is protective, this particular study showed that alcohol consumption is not protective amongst South Asians. So let's look at the inter-heart study slightly more in detail. So there are 9 risk factors given here, and look at that. Lipids, obviously it's very high, 50% cause for the problems, but take these 2 things, which is often ignored. Smoking, we say don't smoke and leave it there, but there is something more to it. They say at least 30 seconds have to be spent at every visit to make people stop smoking. So, and the other part is the psychosocial factor. This is completely neglected by us. When somebody says that I'm not getting sleep, you are getting used to prescribing an alprazolam or zolpidem or something like that. But that doesn't bring down the morbidity or mortality. But treating the underlying psychosocial problem, I will be giving some examples later. That reduces the burden of heart disease. And we all are used to talking about hypertension, diabetes, and obesity. But what is causing this hypertension, diabetes, and obesity is this basically lack of exercise and not taking fruits and vegetables. So if you actually put together fruits and vegetables, exercise, and psychosocial factors, it comes to nearly 55% to 60%. So you just take care of 3 of these things, you're going to reduce this one also. So these are behavioral risk factors. These are all metabolic risk factors. So metabolic risk factors are actually caused by the behavioral risk factors. So if you put both together, then actually you are bringing down 90% of the attributable burden. Yes, people might be familiar with this slide, which would have been shown in many of the preventive programs. This is the DPP study, or the Diabetes Prevention Project, where the lifestyle overscored metformin in preventing diabetes development. Despite all these things, only 53% of the guidelines have actually included all the 6 pillars. So that is the status. And it has to change. Let's see. Well, let's try to take each of these pillars for one by one. So this I'm very sure we would have seen in the latest NIN publication or the ICMR publication for the dietary recommendations in Indians, which says the 56% of the dialysis is because of the dietary risk factors. This is from the Global Burden of Disease study. In India, that's the most important thing. So what dietary factor in India causes this? That's another very important thing. When it comes to this slide, all of us know these factors, that there is a diet which is high in trans fat, a diet which is high in sugar sweetened beverages, processed meat, red meat are all causing problem. But look at that, how much they contribute to. So what are the major dietary contributors for any CVD? It is one is of course high in sodium, but the rest of the things are actually what we have failed to take in terms of whole grains, in terms of fruits, in terms of vegetables, in terms of nuts and seeds, in fiber, polyunsaturated fatty acids, and low in legumes. So this is one carry home message which I like to say. That one of the moderators was talking about that we are all vegetarians. We are all unfortunately contaminated vegetarians. That's the most important thing. So we have been used to taking vegetarian food. Only thing, we are not taking animal food, but are we taking plant food? That was not the case possibly. And that's the reason why we have got into problems. So regarding the diet, I'm going to talk on this 5 P methods. One, where diet has been shown to be effective. We all know that this is a mummy undergoing a CT scan, and this CT scan is basically to detect a CT coronary calcium. So CT coronary calcium is an indirect indicator to say that the patient has had atherosclerosis. So when these mummies were put to CT calcium, majority of these mummies had CT calcium. This is despite the fact that there was no transport. So people were actually walking. Smoking was not known. Blood pressure was another unknown entity. And most of the people were actually thriving on vegetarian food, even in Egypt at that time. So what really provoked the heart disease in these patients? Okay, the most important thing is a common man was never mummified after death. So basically, the king, their family, the royal family, and the priests who were supposed to be connecting this royal family to the god were the ones who were mummified, and they were the only ones who had the privilege of eating all these things, whereas the normal common man was not able to eat. So that's a reason. So it's all plenty of saturated fat, and this was the reason why these people had. So this is lesson number one. Okay, so I'm not talking about other places. Now, about the pioneers and projects. Who has experimented these things? Has anyone done in large scale study? Okay, the first, everybody knows about, majority of the people who are doing lifestyle medicine will be knowing about Dean Ornish and now I think a lot of people have come up. Now in 1940s, Lester Morrison started a program when nothing was available to treat the IHD patients. So people didn't have statins, people did not have antiplatelet agents, not even aspirin. So the only treatment which was available in 1940s was forced rest. That's the most important thing. If you actually read through the development of treatment in CVD, it's really fascinating. So people were put to rest, and even for taking food or going to their restroom, they were not allowed. They will not even allowed to turn. So they had to do everything in their supine posture, and people started committing suicide because they could not lie down for weeks. So at that point of time, Lester Morrison took 50 case control. That time itself, he did a case control study, and he didn't know what this plant-based diet is, but he put them on a moderately low-fat vegetarian diet, and in that, in the cases, 38% survived at 12 years, which is a phenomenal achievement in 1940s when none of the controls survived. So next, coming to Dean Ornish and Esselstyn. So Dean Ornish is a pioneer. He has been working on this for the last 35 years or so. So he got actually impressed by Swami Sachidananda of Tamil Nadu. So this man conducted a study on atherosclerosis for 1 year. So this man was not interested in studies. Dean Ornish was not interested in his studies, and biochemistry actually made him to think of committing suicide. So that was the time when he took off, and then he started thinking rather eccentrically. So that time he went and pleaded his his own faculty, asking them for patients whom they could not treat. So he started analyzing those patients. So he had an experimental group, and yet the standard care control group at that time, whatever was existing as standard at that time. So he analyzed these coronary artery lesions by giving them a complete plant-based diet. And he could actually show there was a regression from 40% to 37% in their patients, whereas the standard care control group, actually the lesions progressed. So he took another subgroup where the lesions were more than 50%. And even in those lesions, there was a regression, whereas in the standard group, there was a progression. So this is the famous lifestyle heart trial, which was published in 1990s. And the most important thing is this preventive program by Dr. Dean Ornish has been approved by the US Medicare. We know how tough it is to get an approval from Medicare. So coming to Esselstyn, okay, Dean Ornish is a person who doesn't use any of the medications. He solely relies on food, exercise, yoga, stress management, and relations. Okay, whereas Esselstyn continues statins and aspirin as in the minimal dosage possible. So he did his experiment on 198 people. Majority of them had undergone either 1 or 2 PCIs and coronary artery bypass surgeries, and these people were followed up for 4 years. And in people who are adherent to his whole food plant-based diet, 99.4 of the people did not have any major cardiovascular events in 4 years follow-up, whereas more than 50% of the people in the non-adherent people had adverse event. So he was the first person to show this. This slide will be shown in any of the majority of the lifestyle medicine talks. So this is the coronary artery disease, and this is the lesion before and after the dietary intervention. So there are plenty of such studies have been done subsequently. And the one which was done in India was the Rajasthan study, namely the Mount Abu part. They had a strong arm in yoga. Okay. So the pioneers and projects, I'll stop here. And the pathways, how does the food actually affect the heart? Okay, we know that eating a good food makes us do good exercise, good sleep, good gets us relieved of stress. And I mean, obviously, when somebody is on a plant-based diet, the chance of them smoking is relatively less, and it improves relationships. And plant-based diet, we all know that it works on diabetes, it's dyslipidemia, hypertension, and obesity. So I'm definitely not going to touch upon this. So when we are on a low-fat and high plant-based diet, all these things come down. That is actually a common knowledge. But what is more important is the unconventional things, which I would like to stress upon. So we all know that LDL cholesterol is a risk factor. And but we all also know that people have a master health checkup, and they all say that everything is normal, and within 6 months or so people get into a heart attack. They said, even I did a treadmill, doctor, that was negative. How did I get into heart problem? That's because of a poor understanding of our own risk factors. So we stop with the LDL. LDL 100 means less than 100 means we feel that we are safe. That is really not the case. So it is not the LDL which is the problem. It is the oxidized LDL which is the problem. So the LDL in vegetarians has been found to be less oxidizable. That was an interesting point which I learned when I started doing these projects. And second thing is the other, like oxy LDL, it is a small density LDL which is a bigger culprit than LDL per se. So we ran a program called the Pearl Clinic, wherein we actually focus on primordial and primary prevention. So the people are subjected to a battery of investigations by our Pearl Clinic people. So I'll just summarize something which this is the last year's data. I have not analyzed the present data. So this is just an passing on information. Out of 442 people, 148 people had normal LDL, but they had a higher small density LDL. And other thing which is often neglected is the lipoprotein A. I see many of the biochemistry labs offer a package which includes lipoprotein A also. And we just pass on saying that your lipoprotein A is high. And we generally say that it is experimental, and a lot of drugs are available. Some of them are toxic, some of them are costly. So we don't prescribe. But an interesting example here. This is a patient who had undergone a bypass surgery, and within 3 weeks of her bypass surgery, she came to us in heart failure and class 4 angina, rest angina. So the surgeon who operated, it was done in a premier institute elsewhere. The surgeon who operated just told her, we have already informed you that your vessels are bad. So we may not be able to do much. So with that picture, she was directed to us, and look at her LPA when lipoprotein A when she came to us, it was 220. So more than 30 is considered as abnormal. So this was in Feb 2024. And look at the value now, it has come down less than, to around 110 or so. From it is 50% reduction, where we actually claim that no drug is available and the diet will not work. But this patient adopted a whole food plant-based diet, and earlier she was not even able to walk 4 minutes. Now she walks 4 kilometers. That's the biggest difference which we could show in that patient. So the other pathways, so whenever we ask about food, how it works on some particular disease, we immediately say it's a calorie restriction. So when we say plant-based diet, it is already low in calories. This is a beautiful picture from Esselstyn. which says that how a 500 calorie actually can fill our stomach. A 500 calorie of fruits and vegetables fills up our tummy completely, whereas a 500 calorie oil fills up not even one tenth of our stomach. So that is the most important thing. So by nature, a whole food plant-based diet is completely low calorie. Okay, that's the reason why a plant-based physician does not talk about calorie at all. Okay, so another interesting pathway which I would like to mention is the gut microbes. So we all know that the gut microbes produce a lot of substances which might affect your heart, which might affect your brain. So we keep hearing the gut-heart association, gut mind association, etc., etc. So this is all because of a production of a substance called trimethylamine, which gets oxidized, and you get a product called trimethylamine oxide when we actually take an animal product. So that works on the blood vessels, either in the heart or in the peripheral vessels, or it can even precipitate an atrial fibrillation, or it can precipitate a renal failure in a susceptible person. So we did a small study on this trimethylamine oxide. This was done in 2000 or 2020 or so. So we had funds for only 44 patients. So these 44 patients, we took this blood sample for assessment of trimethylamine oxide, and less than 6.2 is normal, more than 10 is called very high value. So out of 44, 43 patients who sustained an MI had a high trimethylamine oxide. So that is the cause, that is produced by consuming animal products. And what is important is in 16% of these patients, they did not have any other conventional risk factor which we look for in our clinic, or we all would have undergone. Okay, that's the most important thing. And we followed up these patients for 2 years. People who had a higher TMAO had a higher MACE. And this is due for a publication in Indian Heart Journal shortly. Other pathway which I would like to touch upon is the endothelial function. So we all know that endothelium, that there is the innermost lining, is that gets dysfunctional, and that's the reason for progression of atherosclerosis. So somebody forms a fatty streak at the age of 10 years, that means his or her endothelium is weak for some reasons, mostly because of their behavioral risk factor. So that is the cause for endothelial dysfunction. So from here to, if it progresses to this stage, it is because of endothelial dysfunction. From here, a very big block, it ruptures because the endothelium gives way. So it is the endothelial dysfunction which is abnormal, which is the most important thing. So I would say, now we are used to finding out ischemia. Now we should, Lancet says we should focus on atheroma. I believe that we should actually focus on the endothelial function. That is the culprit, beginning in the progression and in the end of the patient as well. So this is the most important thing. So what is the function of this endothelium? Endothelium basically produces nitric oxide. So the most important thing is whether food can actually enhance the nitric oxide or not. Look at this. All our plant vegetables, whatever we take, have nitrates. Okay. Whereas the non-veg which we take has very low nitrates. So that is something which is important. Again, something which is never talked about when we talk about the plant-based diet. Okay. So there is a classification of vegetables based on the nitrate content. Okay. So I will not go into the details, but I would like to say one important thing. So if you want your endothelium to be intact, you take any form of green, that's a green leafy vegetable. If it's possible to take raw, that's the best way to take, on a red beetroot, which preferably taken in the form of a juice. I'd say that's an interesting study in patients who had undergone angioplasty. So OCT is a way of analyzing the coronary lesions. So people were randomized into two groups. One group was given 70 ml of raw beetroot juice, and another group was given nitrate depleted beet. Look at this. So when the nitrate depleted beet was given, the luminal loss was less in the follow-up. and the events were very less in the nitrate group. So even after stenting, the events were brought down by beetroot juice. That is because it stabilizes the endothelium. Okay. So we also did, this is our own program. This was done right before the COVID. So we also chose to have patients who were highly symptomatic and were around maximal medication following either angioplasty or uh, bypass surgeries. In fact, there were 2 people who had undergone bypass surgeries twice and they continued to be symptomatic. And all of them were on statins when we enrolled them for a surgery. I'm sorry, for this program. And their mean LDL was 82. They were on statins, and importantly, 82% of these people had a normal CRP. This is what we keep on saying. They must be having a high LDL or must be having a higher, CRP, some higher inflammatory potential pathway. So, but then these people, all these things were under control, but they had symptoms. And what is important is 15 of them had a endothelial dysfunction. So what did we do in these patients? We hospitalized them for 10 days. We gave them a whole food plant-based diet. We taught them how to prepare this. We involved their family. So we had cooking demos in these patients. And within 10 days, 8% of this 15, that is around 50% of them improved in endothelial function. And out of the 28, 25 had a symptomatic improvement in 10 days by at least one functional class. Okay, the most unfortunate thing happened after this enrollment in this study. What happened was the COVID came up, and so we had to, we had to give up. We couldn't follow them because obviously they were not able to follow this diet at home. So they started eating whatever they could. Okay. So I will also quote another study which we have been doing. This is a primary prevention study, our own study, PEARL. PEARL stands basically, P is for prevention, EARL is for early detection. Okay, so this is again to emphasize, we had done a CT coronary calcium in 400 odd patients, and 132 of them had positive CT coronary calcium. Of the 132, 116 had endothelial dysfunction. Okay, no other conventional risk factor, namely diabetes, hypertension, smoking, obesity, came closer to this. So I'm not putting up all the data here. This is just to emphasize the importance of endothelial dysfunction in these patients. And as we all know that we give nitrates to these patients. That nitrate is part is endothelial dysfunction. I'm sorry for that. Salicylates, that is aspirin for all these people. Okay, so this is a paper quoting that the Mediterranean diet, which is half plant-based because they also include fish, etc., and olive oil. So that itself is supposed to be containing a lot of natural salicylates. So look at this. Our herbs and spices have the highest salicylate content, which I was not familiar with. So when I started reading for this particular program, so I learned all these things. So vegetarians, to start with, they have higher salicylic acid, which is as good as almost 75 milligrams of aspirin. So that's the important point which I wanted to stress. So when it comes to vegetarians, the inflammatory markers are less. When it comes to omnivores, the inflammatory markers are high. Okay. Okay, do the guidelines actually insist on this whole food plant-based diet, or only the cranky lifestyle medicine physicians are using this? Let's see, whenever we talk about the cardiac guidelines, we talk about the European Society of Cardiology and the American Heart Association. What do they tell? They say that use whole grains, use minimally processed food instead of ultra processed food. So whole is this whole food plant-based diet is basically minimally processed, whole grains, and look at the fruits and vegetables which are prescribed, which is around 200 grams each. That is around 400 grams to 600 grams of fruits and vegetables. And when it comes to proteins, ESC guideline says majority of our protein should come from plants. So this is precisely a whole food plant-based diet. though they actually do not use that same word. Okay, so has it been accepted by other countries? I would like to quote only one here. Look at this Qatar. Qatar says whole food plant-based diet is a complete food. Okay. And Norway says it is applicable at all ages. So that as neonatologist, I think you can take this into account, though I don't have much of an experience in giving this for our youngsters. Of course, we have started a program where we have started recruiting kids beyond 20, not below, beyond 12, not below that. Okay, so many guidelines are changing over to whole food plant-based diet for various reasons. So that's about the pillar number one. So pillar number one is basically on food, how the food helps and what our own personal experience is. The rest of the pillars are majority, I mean, will be obvious to majority of you, but I would like to stress upon few things. Some interesting study about the exercise. So physical activity and the clinical guidelines say that one has to exercise around 150 minutes per week or 75 to 150 minutes of vigorous exercise plus 2 days of resistance work per week. Okay. Is there a study which compares exercise with any other modern modality? Yes, there's a beautiful study which was published in 2004, which is comparing exercise versus coronary angioplasty in patients with stable coronary artery disease. So this was an RCT which ran over 12 months. Look at this. They were just made to do arm ergometry for 20 minutes. Just 20 minutes exercise every day compared to angioplasty. Event-free survival at the end of 1 year was 88% in exercise arm, whereas it was 70%. Not bad, but definitely worse than the exercise arm. And they were able to exercise better, that's obvious. From 22.6 to the maximal oxygen uptake went up to 26. And the cost to make them to make them class 1, the cost involved in exercise was only this, whereas the cost involved is $6,956 in the stable the angioplasty group. There's an interesting comparison. So we have finished 2 E's. We are going to the 2S, stress and sleep. Okay, so I'd like to play this video. So this was about World War II, where the government decides to evacuate 80,000 children from Finland to the neighboring countries. So they had to leave their country to live with Swedish parents or some orphanages in the neighboring countries. So they started developing health problems and they started indulging in alcoholism and smoking. The funniest thing is they had even forgotten their own mother tongue and they couldn't even identify their parents when they went back to their home after the war got over. So these are some photos of the kids leaving their country and how they were giving farewell to their own siblings. And the key message here is when these people were followed up in the future, the majority of them had actually developed type 2 diabetes and a higher incidence of CVD was seen in their late adulthood. So this is a life traumatic experience. So I'm sure all of you must be using the term AC, that's adverse childhood event, which affects the hypothalamic pituitary adrenocortical axis. And there is some other data about the Afghanistan. Okay, so we all know that it is eternally involved in the war, and the heart disease, amongst the heart disease, the Afghanistan ranks 6th. And this is related to the stress which these people undergo in a very young age group. This is a beautiful novel called Kite Runner. He quotes something like there are a lot of children in Afghanistan, but then very little childhood. So my own personal experience, this was about a bank manager who had undergone an angiogram because he continued to have effort angina. Then he was admitted once as an unstable angina in a nearby hospital. So he underwent an angiogram, and angiogram showed double vessel disease, and the disease was in small vessels and distal vessels. So the doctor rightly said you will do well on medication. But unfortunately, he never did well and he decided to switch over to us. So initially, when he came to me, I thought there was a lot of scope for optimizing his medication. So I increased his beta blocker, I increased his nitrates, and I waited for a few weeks, but he kept coming and he was never cheerful. So then I started probing, then he started coming up with some stories that whenever he walks, some few thoughts started coming into his mind. So that thought was about a court case which was pending. He's a retired bank manager. So the case was filed 20 years ago and it was going on. And I believe this is still going on. It's 10 years now and he's free of his symptoms because our psychologist dealt with his emotional control. So, and he was initially put on some drugs by the psychiatrist also. And now taking care of the stress part has actually relieved his angina without any other additional procedure or any other additional medication. About the sleep, okay, this is something which is again interesting. Every 1 hour night decrease in the sleep below 7 to 8 hours increases the risk by 6%. And if you actually sleep more, which I don't think any of us do, unfortunately, fortunately, it increases the risk by 12%. Okay. And needless to talk about smoking, how it helps. And this is again not given too much of importance, the social support. Okay, Rosito, a place called Rosito. And this place, people were not dying out of heart disease, but they were dying out of old age. So they didn't know why these people did not have why these people didn't have heart disease. So Dr. Wolf went through their history, whether they were smokers or alcoholics, which they were, but despite all those things, they had um, a good uh, cardiovascular protection. So he said it is Rosito which was keeping them healthy. So what is so special about Rosito? So they were all living as a single family. They spend their evenings together. They share their meals. I'll show a small video to make you understand the Rosito story.
In the 1960s, a US town called Roseto was an anomaly in America. No one under 55 had died of a heart attack or showed any signs of heart disease. The local death rate for men over 65 was half the national average. A team of researchers led by Dr. Stuart Wolf considered whether this was because of their diet, location, family history, or exercise habits, but on the surface, nothing was different from the rest of America. In fact, the town was made up of Italian immigrants who worked in quarries and factories, smoked unfiltered cigars, and had dinner tables laden with rich Italian food. Rosettans of the 1960s still held on to their old world ways. It was normal to find 3 generations under the same roof. 80% of men in the town were members of at least one community group. They would gather in each other's kitchens, play cards, and simply talk. The conclusion? Rosettans were nourished by each other. Over the next decade, the multi-generational homes broke up, and by 1971, when opulent houses, expensive cars, and swimming pools appeared, the first person under the age of 55 died of a heart attack. By the 1980s, the rate of heart attacks in Roseto was the same as the rest of the country.
So when people started moving out for money and the families became smaller and the disease started appearing in them also. So that is the reason why they say social connectivity is important and it gives a lot of protection, just not to take them to the hospital, but also in preventing diseases. And that is the reason why people say pets actually reduce the stress. So I think apart from asking ourselves whether you are a diabetic, hypertensive, do you smoke, your BMI is less, your waist circumference is less than 90 if you're maybe less than 80 if you're a female. I think there are 6 pillars which need to be addressed by taking just 2 questions. So do you walk? Do you do a strength training? Do you look at that nutrition? They are actually not even considering whether you are taking meat, whether you are taking sugar sweetened beverages, etc., etc. They are only asking whether are you taking 3 or more servings of vegetables per day, and are you taking 2 or more servings of fruits per day. That's all. That basically comes to 5 servings. I'm not sure how many of you actually take 5 servings per day. I'm very sure Dr. Manoj must be doing this. And regarding the sleep, okay, do you sleep 7 to 9 hours every day? Do you wake up feeling well rested? So similarly, there are 2 questions for stress, substance abuse, and connectivity. So this is what is the most important thing, because this covers around 60 to 70% protection, and the rest alone is given by what we have all been used to so far. So where else can this lifestyle medicine can be applied when it comes to heart disease? Yes, the metabolic risk factors, hypertension, diabetes, dyslipidemia, obesity, coronary artery disease, which we have seen. It is useful in peripheral vascular disease also, and in protection of in preventing heart failure as well as treating heart failure. And interestingly, people who were put on plant-based diets did not have AF in follow-up, atrial fibrillation. So that is something which is important. I will stop here. So wishing you all Akia. Akia has another meaning. It represents the desire not just for personal success, but for leaving a mark on the world. So let's leave a mark on the world. And I have a special request to the neonatologists here. I recently managed to study about the lifestyle modification in the pediatric age group. I presented one for the pediatricians last Sunday, and there is a lot of scope for us to involve the lifestyle pillars, which are no different from what is prescribed for the adults. And because you people can together bring down the incidence of heart disease, because I think today and in the last week, JACC had come up with a projection as to what Asia is going to face in 250. I haven't gone through the study yet. So apart from carrying our pills, it's important we carry the 6 pillars. It's just not pills, it's the pillars of lifestyle medicine, which are more important. And thank you. Thanks for the patient listening. And thank you, Dr. Manoj, for giving me this opportunity, and to the moderators too.
Wow, actually, like we should be thanking you, Dr. Rajendran. It was such an amazing talk. Lot of eye openers, and the kind of original work that you're doing, we are coming to know. I can just say amazing eye opener. That's all what I can say. Like, over to you, moderators, for the questions. Which may be there in the question chat box or in the Q&A box.
Indeed, Dr. Manoj, I have same feeling that sir has really, it was like I thought it's very short time. Yes, still he can go on telling us different the videos of Spanish, this Finland, and that are really eye-opening. Our old culture was similar only of 3 generations staying together, And that's what really we treasure we had. And that was one of the preventing factor. That's really great to know. We'll see the chat box, Dr. Sri Sailam.
Yeah, there was some appreciation, and apart from that,
Yes.
uh, wonderful, sir, and excellent. And we came to know few new things, and excellently you told that Rosetto. I think we should all follow that, and a part of the relationship and plant-based diet. I think Manoj sir and Pooja ji, we have been doing that from past few years, and we can see the glow and smile in all the people of the lifestyle group. So we are strong believers that the plant-based diet is excellent, and you have sent the message that the heart disease, the root cause is not in the heart, but is in the lifestyle. I think the five pillars, six pillars, what you're telling, the two A's are, I think we'll carry forward. I think we should be an example. We should walk before we talk.
There are few questions privately messaged to me. You should be posting it here, but anyway, I'll just read out. One of them is regarding one of the papers published by Luigi Fontana last year regarding 10 tips for promoting cardiometabolic health and slowing cardiovascular aging. Actually, uh, it says alcohol abstinence a prudent choice for cardiovascular health. Also, the question is alcohol intake to be abstained only in South Asians, or is it a universal phenomenon? Dr. Rajendra.
I was talking about the inter-heart study, which differentiates between the Asians and the rest of the people. But now almost all the guidelines say abstain from alcohol completely. That applies for everybody. So I didn't want this to be used as an excuse. That's why I said that there is a difference.
Thank you. Another one is regarding the one of the things he has mentioned in that paper was intermittent fasting and time restricted eating. How is that heart protective?
I'm very sure it is known to protect the metabolic parameters and obesity. I have not come across a study specifically. I've not read in this context, but we do advise people who are willing to take it, but we don't force that on them.
Sir, I had one question. That we have three body types, right? Uh, Mesomorphic, endomorphic, and ectomorphic. So the people who had high cholesterol, should they go for intermittent fasting? Is it helpful to them?
That's what I said. It definitely is useful
Yes.
in metabolic parameters. And for the cardiac part, I have not come across a study. It's not that there is no study. I have not done, I'm not this thing, but we don't force it on our people, but we advise them. But what in the name of intermittent fasting, I don't make them fast. I mean, make them eat twice, but I agree to their eating of pattern of thrice. But only thing is, I give them a time restricted eating. That basically means I tell them you finish your dinner as early as possible and push the breakfast little later. So that comes to around 13 to 14 hours.
And I like one thing, sir. You are not asking the population to restrict anything. You are just asking them to add fruits, add vegetables, so that automatically the things will get restricted. But if you force someone to restrict, they will not go, they'll not be able to sustain. So this is very good what you have said. And you have given a target of per week rather than daily. So that is really doable, what I personally feel for the general population, especially the teens. As you said, the pediatric studies are also coming up. I come across many teenagers with metabolic derangements. So it is very good for them. Just okay, you whatever you want, you can just add vegetable and then start with other restricting things. This is really good. Otherwise, for today's teen generation to make them restrict certain things, it is really difficult also.
Doc, I just would like to add two things here. The diet which I said so far is basically for people who don't have a disease or who don't want to invite a disease. But if those people who are hospitalized, they will
Yes,
completely, because they have had severe symptoms. So severe symptomatic patients, we completely avoid animal food as well as oil. Okay, that is number
yes, yes,
one.
yes.
Okay, and number two, just wanted to quote one thing, might be out of context here. Yesterday morning, I was stuck in the traffic. So my postgraduate called me up and said, I have a boy who's 20 years old and he has 100% non-cardiac pain. Shall I just do an ECG and echo and leave him? Then I said, no. How, um, whether there is a family history, you ask whether there is a family history or whether he is obese, etc., etc. Usual questions which we ask, and ask for lipid profile and HbA1c. So he was a little upset. So he's only 20, he said. Then I kept the phone down. He realized that I was very upset. Then he asked for it. Then what I did was I called up the IT people because it was taking more than an hour for 6 kilometers of travel in the morning. So I called up the IT people. I told them to pull out one statistics. How many people between 20 and 25 have visited PSG hospitals in the last 6 months? Okay. 6,500 people had visited for various reasons. So I asked them for how many people have we done HbA1c. Okay, surprisingly 550, less than 10% we had done HbA1c, of which 1/4 had A1c of more than 5.7.
Mm.
Okay, and there around 10% had a frank diabetes.
Oh.
So I'm actually going to go through this and make it a study because I was going through the guidelines. Guidelines do not ask everybody to get an HbA1c at this age group unless there are compelling indications, like for example, a family history or a classical symptom of a diabetic, etc., etc. So I think we may have to change our own guidelines. That's the most
Yes.
important thing.
Yes, sir. True.
There are two questions. One in the Q&A pane here. Sri Salem, or do you want to read out, or?
Yeah. In the chat box, nothing is there.
No,
Yeah,
I
in
can
the
read this.
Q&A.
Are
Yeah.
plant-based protein powders safe for consumption to increase protein intake? If so, do you advise any limit? In lifestyle medicine, we never advise anything that is processed. Whatever comes in the market will always be processed. And so we will definitely get enough of proteins in our own natural diet. I'm sure Dr. Pooja is there. She will be able to guide us in that.
Yeah, and the other one is on LDL. No? Yeah, yeah.
I can't see the question here.
No, it is some questions have been messaged to me.
Okay,
Yes,
okay.
because we are not able to see that question in chat box.
All right, all right.
I can see
This
that
this was there.
open
Yeah,
LDL.
it is about something that we discussed previously. What is the safe limit for LDL? If you follow it was discussed by the Dr. Rajendra. If you remember, in another context, we had discussed the same question has come up. What is the safe limit for LDL in a plant-based? If you are taking a plant-based diet?
No, there's not going to be any difference in the cutoff. Is that the question?
I think so. I
Because
think that is what is meant. In a plan, if somebody is taking plant-based diet, should
no,
it
there is
be
no
equal?
such cutoff for a plant-based diet or anybody. For everybody, if it's for a primary prevention, it is to be less than 100, and if it is secondary prevention, it's preferably less than 50 to 70.
I think he was thinking about oxidized LDL. What?
Oh, oxidized LDL levels, I have no idea. That was based on a study. I found it very interesting, so I thought I will quote that. That's all.
And
Because we don't measure the oxidized LDL, we measure the small density LDL, which is supposed to be less than 30.
now another question has come. So is not keeping the HDL high not good enough? HDL.
HDL high not good enough when compared to low LDL.
Probably,
That is
probably,
possibly the
yes.
question.
Probably, yes.
Well, now almost all the guidelines focus only on LDL and not on HDL, and we don't actually see a very good results in hiking up the HDL, unfortunately, with medications or with food. So it's exercise which is going to be useful in such patients.
Great. I request everyone to put your question in the Q&A pane so it can be seen by everyone.
Yes.
Can we have a recording? Somebody has asked. Yes, the YouTube recording will be shared with with you. There is a YouTube recording going on. Yeah. Is there anything more?
No, sir, there is nothing in chat box. And Q&A session, we have already answered.
Food groups are for lowering LDL cholesterol.
Pardon?
Specific food items rather to lower LDL cholesterol.
Okay. Okay. Well, I would say just anything that increases the fiber is going to reduce that. Okay. So that fiber content is obviously majority of the times is from your vegetables and fruits. So anything, any fruit, any vegetable that is high in fiber, that's the best way to go about. That's the simplest answer. Of course, there are small things which we can or also add on. That is a different story.
Thank you very much for this delightful presentation that you've given. Two quick questions. One is, besides using something like a periscope machine, do you
Dr.
have any...
Herb, you are a legend yourself. Why don't you, I mean, like, if you are, I mean, if your connectivity is good, why don't you put on a video? We want to see you.
I'm happy to put on my video. I'll have to use a different device because my camera is not working on this device.
Yeah. Please go ahead then. Please go ahead. Yes.
Besides using something like a periscope machine, do you have any other easy way of measuring endothelial health? And number two is
Endothelial health, sir?
Yes. Number two is how much fiber are you recommending?
How much
fiber are you recommending per day?
How much of fiber? Okay, the recommendation is around 40 grams. And for the endothelial part, we actually use a machine called EndoPat. So that is basically which a simple principle is basically occluding a vessel and see whether there is a hyperreactivity.
Thank you. Here we use a periscope machine, but I'm looking for something that is simpler.
Yeah,
and
periscope
easier to
is
use
more
and
of
cheaper.
okay. We also have had an experience with periscope, but I thought the values were not actually corresponding to the patient's condition. So we are using what is called as an endothelial dysfunction assessment by EndoPat. EndoPat is an FDA approved method.
Thank you. Appreciate
Thank
your
you so much, Professor
Sir,
Herb,
you
for
said 40
joining.
gram. Sir, just a
Yeah.
he said that 40 gram of fiber. So for a practical implementation, it will be how much vegetable to consume per day?
I think I will just stick on to the same thing called three servings of fruits and 2 servings of vegetables.
But that is
I'm
300
sorry,
gram,
it's
500 gram.
it's the other way around. It's the other way around. 3 servings of vegetables and 2 servings of fruits.
Yes, sir, but the amount, gram. How much amount of
Gram
vegetable?
will come to both put together will be coming to around 400 grams. The more
Okay.
more the better.
Yes. Okay.
Dr.
Okay. Thank
Pooja,
you, sir. Thank you.
So
would you like to add on anything here?
yeah, the whole grains and the nuts and seeds. And so maybe 3 to 4 servings of whole grains, 3 to 4 servings of legumes, and 1 to 2 servings of nuts and seeds, adding to the fruits and vegetables.
Adding to the fruits and vegetables.
For the awareness of all, this program, HLI program, has been launched by NNF in association with CMC Vellore, and thanks to Professor Herb and Professor Sam for actually initiate and joining in this this thing. Professor Herb, would you like to say anything more?
Sure, I have one more question. If I'm on long enough, I'll ask many more questions.
Please go ahead.
How do you interpret and understand the new report published by Dr. Anjana and co regarding our carbohydrate intake here in India?
Oh, the present study, sir, I have not got through that in detail. I've just been seeing in WhatsApp messages. So I don't think I should make a comment on what was seen as a WhatsApp message. I need to go through the original study. Sorry for that.
Thank you very much.
I know that puts the blame on carbohydrate part, but that is all more of a superficial discussion. I wouldn't like to comment on that.
Thank you.
And sir, could you add upon the fiber, the source of fiber also? Like we have just talked about the plant-based. The one fiber that is derived from the millets is much better than the one which is
Much better than?
the one which is from the other cereals, legumes, and all.
Well, I don't have a personal experience of splitting this fiber into these things. I may not be the right person to answer that. So, I think Professor Herb can take up that question.
It's true that we often talk about the soluble and insoluble, but my dietitians here are the ones who are specialists in this. So I would love to defer to them, but I also it is too difficult from my meager experience, since I'm not a dietitian, to try and sort out soluble and insoluble fiber. I lump it together, and we typically have 2/3 portion on average and 1/3 portion making it up.
Basically, in the present way of prescribing things, there is no need to split between protein, fat, carbohydrate, fiber, etc., etc. It's more of a plate concept. So we don't teach them calories also. We only teach them the plate concept. And in the plate concept, again, we don't thrust everything onto them. We actually look at their plate and try to change it slowly. So that happens to be a very practical method rather than telling that this has more fiber, that has more fiber. So, and of course, in the diabetic management, we make things easier for them to understand by putting them on cells. Say when I add on this becomes my sugar becomes more. When I withdraw this, my sugar is better. So in fact, we all are all learning. So basically, as he said, I'm not a nutritionist, so I'm okay with prescribing diet in the form of a plate rather than its individual constituents.
Sir, your
There is a
beetroot
question by
study was
Shwetal. There is a question by Dr. Vishwanathan.
Yeah, Kenny, thank you.
in
Thank you.
okay.
Just listening to you. I just also want to ask about it's not about the fiber, the solubility, the insolubility, the viscosity, all those also matters actually. And because, you have a group of people who has got IBS, who has got
Constipation and all. Oh, yeah.
and diarrhea type.
Yes.
In those, people, the constituent of the solubility, the viscosity, all those things also matter. So it would be nice to, throw some light on that. Thank you.
Well, I will have to do a lot of homework on that or get my dietitian as sir was
You can
saying.
take that question. Yeah.
So earlier it was thought that soluble fiber has a role, and we advise around 10 grams of soluble fiber from barley, oats, and that's why oats gets the name soya bean and all that. But now even studies point out that even insoluble fiber may have a role, and so fiber is actually soluble, insoluble, and fermentable fiber. So it may work with different mechanism, like the insoluble fiber will clear the waste fast, and the fermentable fibers, the gut bacteria will have a role to lower the LDL cholesterol. So all three will help actually.
Okay, because there is one
No
nice
need to differentiate, only go with the quantity. Like sir said, 40 grams. So ensure that you get 40 grams of fiber.
Okay, thank you very much. Thank you.
Some have done studies with 60 grams and have found out useful, but I don't do a hair splitting there.
So you quoted that beetroot's juice. How much ml and raw or cooked beetroot?
Raw. That what we advise is around 60 to 100 ml per day. Raw,
Okay.
and it has an earthy smell. So we tell them you add whatever you like, but what I add is basically ginger and cardamom to it.
Great. Thank you, sir.
It's, off note. Personally, I also take beetroot juice. Lime also would work, actually.
I see.
Lemon. If you can put lemon, and then probably you can mix, add another fruit along with that, or some things like that you can do. Even ABC, but ABC you would be in you have to be put more beetroot if you want to get the night probably. But anyway, like, so anything, these are not things where the amount you have to take. The consistency is what matters. You take for 5 weeks, 6 weeks, and then you stop, and then you say, I did not get this. The consistency, by
Yes.
consistency we mean years, 10 years, 20 years. We need to do that actually. So let's
Yes. It
not
has
go
to be
ahead with
part of your
any
routine
volume.
schedule.
Yeah.
So
Good.
will chewing be better to release nitric oxide than like in beetroot and greens, or consuming juice will be?
As far as greens are concerned, that's what I said. If you could take actually raw ones and chew them. Okay, basically, Esselstyn is the person who promotes that in such a big way. And he says 6 servings, which I mean, I definitely don't take that. And 6 servings of raw greens, which are to be chewed. So to get somebody to eat one serving itself is very difficult. So I don't tell them that you have to definitely take it in the form of raw, but I tell them at least once you try it, and other times you try it as smoothies, or of course, in salads again, it becomes raw, or in the soup, or I tell them to mix it with chapatis or dosas. So those are all cooked ones. Okay, but the ideal is um, always raw. But one important thing is eating something is always better than not doing at all. So in whichever form they want to take, I tell them you take.
All right, I think we will call it a day now, or call it a night, or what I call this thing. So thank you so much, Dr. Salem, Dr. Shwetal, for moderating the session, and special thanks to our guest faculty today, Dr. Rajendran. It was a very interesting evening. I hope all of us who have been listening would have definitely benefited, and then let's continue our journey in this or rediscovery of this branch of medicine called lifestyle medicine. So with this, we close today's session. Thank you so much. Special thanks to Dr. Rajendran once again. Thank you.
Thank you all. Good night.
Thank you.
Thank you, sir. Thank you.
Good night.
Thank you.